Hey guys, it's Dr. Emer. We're in West Hollywood. We're nearing the end of the day, and we have one of our most beautiful patients coming in for his year to year and a half maintenance sculpting treatment. Obviously, we look at him, super defined jawline, high cheekbone, luscious lips, straight nose, everything looks great. Why does he need any treatment? He really doesn't. This is just to keep it that way. So what we're going to do, because the look he likes is a really sculpted look, we're going to do a little bit high into the cheekbone, soften some of these creases that start to develop around the chin as we get a little older, do a little lip plumping and some softening of the folds. The reason I like to do, certain men like to have a little bit more of a sculpted look laterally in the cheek because that gives them more enhancement in their actual jawline and overall shaping of their face. We're using a filler here called Revenus Versa Prolinium. I was one of the first doctors in the US to use this a little over a year ago. Actually, on my patient here, when it came from Canada to the United States. This is a very popular filler outside the United States because it doesn't swell a lot. And you can see, you get an instant lift, and you can see that lift right there. We have that already. You can see that little chisel. If we draw a line from his lip up to the top of his ear, you could see that enhancement starting to form right there, because we did about half of a syringe into the lateral part of his cheek. We're now going to go to the other side, turn, same thing. We're going to follow that nice line. We're going to get a little bit of definition there. I'm going to grab that from you. Go ahead and take that. We're going to follow with a cannula. We're using a cannula because this limits bruising. Now, some men have thicker skin, so it's a little harder to get the cannula in, but once we get it in there, it's not that painful, very minimal bruising. We're just following to lift that deep medial fat pad of the cheek. We're just trying to lift that up so we can get improvement in his under eye, sculpting in the lateral border of the cheek, and overall volumization of the mid-face, because as we age, you know, that area starts to lose volume and it starts to sag. So here we are, little thin strands right on the bone, coming back with the cannula, and we're doing, how does that feel? What does it feel like? Everyone always asks.
I don't feel anything, just a little pinch at the beginning and that's it.
Nice. And we're just giving him that, a little bit of that chiseled look that he wants, the very model-esque look. You always want to assess each person's face individually so we can determine what's the best for their ultimate goals. And for him is tonight have a nice high shadow on the jawline, on the cheek, which will balance his overall larger and defined jawline. So if I look at straight, you can see that the OG curve is very balanced. It's nice and lifted. He has some lifting in the midface and it balances here, so that's a perfect half a syringe aside. Now what I'm going to do is I'm going to go towards his chin, and I'm going to balance out how his chin is projected using a needle, because this area here is a little bit easier. You see now we have that chiseling effect. He has got a nice wide, we don't want to widen it more, we just want to define it slightly, so we're going to go right on the bone, just a small amount. And the one thing, again, like I said about the Prolinium product, is that what you see is pretty much what you get, because it's already pre-hydrated. Even though this is a hyaluronic acid filler, similar to other hyaluronic acid fillers like Juvederm or Restylane, this doesn't hold as much water. And so long term, turn a little this way, we're not going to go laterally on him. We're going to keep this very strong and bold in the center. We're going to do here, and then we're also going to go up into those creases and fill what we call the lower cutaneous lip area. Good. Great. Now by giving him a more bold and pronounced chin area, this helps the lower part of his mouth look more defined. It helps his jawline appear more strong, and it balances the higher cheekbone. But the key is, for certain people, you don't want to go too laterally. So for him, we're keeping it medial, and then we're softening that line that he doesn't like. Perfect. So now we have that little bit. Now look, elevated cheekbone, perfect. Projected chin, perfect. Turn to the side. Defined jawline, elevated cheek, projected chin, looks great. Now let's do a little softening on the lips. His lips are pretty perfect, but we gotta keep it that way. So what we're gonna do is we're gonna use the Versa product because it's soft and it only sort of hydrates the area. And for people that don't want much more size but want it just to look a little bit more hydrated and kind of with a little bit of a plump, but not over voluptuous, this is the perfect one. And weird feeling with the cannula, good. So we're gonna go in there with a 27 gauge long cannula, and this is gonna limit the bruising as well. We're just gonna do a small thread, nice and slow. Studies show that if you go really slow with injection, it's much less likely to swell or bruise. Perfect. So now let's go to the lower. And now same thing for him here. If you look at the lip, he's got a perfect Cupid's bow and he's got a nice pillow to his lips, so we don't want to overdo it. So we're not gonna go all the way lateral. We're actually gonna come more medial. Deep breath. We're gonna go all the way across, and we're not gonna go fully across. We're gonna go 3/4 across. This is the trick, to keep it where just the center part is plump. Otherwise, you're elongating his face and giving him the Julia Roberts smile when he doesn't have that naturally. We wanna make him look normal and natural. She's got a perfect smile for her face, but not for his face. Great. Perfect. Now let's switch sides. We're gonna finish up on the top. And you can see we kept at medial, did a nice elevation on the upper border. Go ahead and grab that. I'm gonna go right up, deep breath, good. Sorry. Going a little bit in different layers here. But again, soft filler, long-lasting results. Perfect. So that's 3 syringes, softening kind of all over. Let's show him. I actually think that creased it really well. Let's show him. We're gonna wipe him off. We're gonna let him see. Can't be any more perfect than that.
Like it.
So elevation, a little bit of projection, softening. As we age, this part comes down because the bone structure of the chin actually comes in, making the lower cutaneous lip fall inward, chin backs down. So we lift it forward and we soften around here, which also everts the lower lip. Now we kept the lift a little bit bigger and more medial, a little lifting through here, just soft hydration. And by adding a little bit through here, actually helped his under eyes. So we got full facial sculpting in a male, exactly what you wanted, a year later. Perfect, thanks guys. That was good.